Hello, good day everyone. My name is Salinity Montalbano, and today we are here. I am here to perform the assessing of blood pressure. So the first step is we are going to the assessment. So in the assessment, we are going to assess for the signs and symptoms of hypertension and hypotension, and also the factors affecting blood pressure. After the assessment, we are going to proceed in the planning. So in planning, we are going to prepare the equipment that we need. The stethoscope, the sphygmomanometer, and the blood pressure cuff. So after the planning, we are now going to proceed in the implementation. So the first step in implementation is perform hand hygiene. And also, we are going to provide privacy for the patient. After that, we are going to position the client appropriately to have an accurate result of the blood pressure. Excuse me ma'am, may I touch your arm and
Yes,
place
ma'am.
it in the table? Then after that, flex the arm and the palm should be facing upward. Okay, so after that, excuse me ma'am, may I expose your upper arm and fold your sleeves?
Yes, ma'am.
Okay, so after exposing the upper arm and asking permission, as what you have seen, we are now going to wrap the deflated cuff evenly in the patient's arm. Not too tight and not too not too light. Okay. After that, we have already wrapped the deflated cuff. We make sure that it has a space and 1 inch above the antecubital space. And after that, we are going to locate the brachial pulse of the patient using our 2 fingers. So, after we have already located the brachial pulse of the patient, we are now going to perform a preliminary palpatory. We are going to close the valve and we are going to stop pumping until we have felt no pulse at all. And release the valve carefully. So the palpatory of the patient is 110 because that is where the pulse is no longer felt. So after that, we are now going to uh, uh, look for the systolic and diastolic blood pressure of the patient. We are going to insert this earpiece in our ears and uh, uh, insert or put appropriately the diaphragm or the stethoscope in the brachial pulse, where my two fingers are located. Okay, we are going to hold the stethoscope using our thumb and our index finger like this. Okay, so a while ago the palpatory is 110. I am going to add 30 millimeters of mercury so that we came up with a 140 millimeters of mercury. And we are going to pump until that portion. We are now already closing the valve, and now we are going to pump until 140. And then slowly release the valve. Release the pressure. Okay, so it is already done. So the patient's result is a while ago 110. So the palpatory is 110. So the patient's result is 120 over 60. We are now going to record it. 120 over 60. Excuse me, ma'am. May I now remove the cuff? Okay, so now we are done with the blood pressure, assessing blood pressure. That's all. Thank you.